Welcome to the 2024 Children's Scorecard. My name is Barb Finch, and I serve as the Director of the Kids Network, administered through the Santa Barbara County Department of Social Services. We're glad your curiosity has led you to this webinar, and we hope you'll find this presentation to be both useful and compelling. We want to begin with a heartfelt thank you. The last Children's Scorecard was published in 2017 by a small team of contributors. With guidance from Maria Chesley and Community Systems Consulting, Kids Network and Together for Children are proud to present the latest edition, created through an inclusive, collaborative process that engaged community leaders and content experts from a wide array of child and family serving institutions, community nonprofits, and county departments. We're grateful for the dedication and commitment of all those who brought the 2024 Children's Scorecard to life. The Children's Scorecard is produced by the Kids Network, a countywide cross-sector network created by the Board of Supervisors in 1991 to advance interagency cooperation and advise the board on issues related to children, youth, and families. First published in 1994, the scorecard was initially produced in partnership with UC Santa Barbara's Gewurz Graduate School of Education. Throughout the years, publications included core indicators and data compiled with input from the county departments and key stakeholders. The scorecard describes the status of children and youth through the lens of physical, emotional, educational, and social well-being. It is intended to guide public policy, to inform and align continuous improvement across sectors so that children have every opportunity to grow up healthy and successful. The 2017 scorecard was a significant undertaking. We shared the best data and illustrated trends in each sector while also showing how networks were supporting collaboration. We highlighted frameworks that were guiding cross-sector efforts, including the Strengthening Families Protective Factors and the Science of ACEs and Resilience. These elements were described in great detail, and while we decided not to include that level of explanation in 2024, the 2017 scorecard remains relevant and worthy of exploration as an additional resource. The 2024 edition was developed in collaboration with Together for Children, a committee formed in 2022 by the county's Child Welfare Services in response to the Families First Prevention Services Act. This group was charged with developing a comprehensive prevention plan for Santa Barbara County that promoted community involvement and included all levels of prevention, addressing child abuse and neglect, as well as youth violence and substance abuse, with an overarching goal of community well-being. The 2024 scorecard was envisioned as a benchmark for continuous quality improvement. The 2024 scorecard exemplifies a new level of collaboration among county stakeholders. Rather than relying on the work of a small committee, the components of this year's scorecard were developed through a series of workshops with a vision of well-being driving conversations. Indicators and measures emerged from facilitated discussions about what we want to know rather than being guided by what we're already tracking. Committee members were also asked to identify celebrations and critical needs that have emerged since the last scorecard was published, and these were refined during several subsequent meetings. With current information on key data points and narrative explanations describing what we know and how we're making sense of things, the 2024 scorecard represents a post-pandemic baseline and a new vision that can be monitored over time. When you're using the 2024 scorecard, there are a few things we'd like you to keep in mind. First, we encourage you to approach the data with curiosity and compassion. The intention is to use the information as a flashlight that illuminates rather than a hammer that condemns. Numbers tell us some things, but they won't tell the whole story. Connecting with the families represented by the data is the best way to understand what motivates decisions and what factors may be influencing countywide outcomes. We assume that people are trying their best, want the best for themselves and their children, and that they act logically given the choices they see. For example, people may be reluctant to work additional hours or take a higher paying job if it means they would lose public health insurance or subsidized housing. This welfare cliff, as we call it, is a system issue that needs our attention. Second, be aware that we're most often reporting data at the county level, and that this masks regional differences and racial and ethnic disparities, which are worth investigating. As an example, the median value of owner-occupied housing in the city of Santa Barbara is over 1.1 million, while in Lompoc, it's 353,000, and in Santa Maria, it's 376,000. Rents follow a similar trend, representing significant differences in the cost of living. Racial disparities and inequities add another layer of complexity that impacts well-being in some parts of the county. We haven't provided extensive breakdowns because we know people have different interests. Indeed, the invitation is for you to be curious and dig deeper. We've left pathways for further exploration in the appendices, including links to measures that break data into smaller groups. We also want to point out that sources of disruption have affected data and trends. Beginning in the spring of 2020, the COVID-19 pandemic created major disruptions throughout the community. We saw significant reductions in services and services that were modified to virtual formats, along with many other changes. We look at the 2024 data, and we know that some of it may reflect short-term effects or emerging trends as a result of the pandemic. Our current baseline data may show the impact of these disruptions on children, youth, and families. Moving forward, we're also contending with dramatic policy changes at the federal level that are causing trauma in local communities and destroying the safety net for some of our most vulnerable community members. This scorecard is structured around a basic model of the people and societal conditions that affect child outcomes. For the child, we're looking at cognitive development, health and well-being, and preparation for adult life. For the family, we look at whether they're meeting children's basic needs, providing safety, and offering social emotional guidance and nurturing. When it comes to the system of care that exists for families, what does that system look like? Are there adequate services to address challenges and prevent further problems? How are we connecting families to the supports they seek? The linkages among sectors are important for understanding how things work together and what happens when they break down in one area or another. This type of systems thinking and the attempt to define the system is foundational to our work on this year's scorecard. Finally, what are the conditions in which families are raising their children? This concept comes from public health. The idea that there are social drivers of health and well-being, or social determinants of health, that include economic stability, healthcare, and education access, community context, and built environment. To summarize, the model can be understood as a theory of change that has three overlapping components. Outcomes for children and families will be positive if the system of care for families is effective, and the conditions for raising children are healthy and supportive. If we hope to change outcomes for children and families and improve our system of care, we must address the conditions for raising children. This is our first attempt to explore the notion that community well-being depends on the conditions for raising children, and the long-term solutions to social problems depend largely on how our children grow up. The scorecard is structured around four key areas: child and family outcomes, conditions for raising children, the system of care, and then conclusions and recommendations. We'll examine each of these sections in detail. As mentioned, we developed this scorecard through a collaborative process involving many stakeholders and multiple meetings. We followed a comprehensive approach that began by listing all possible indicators, then worked towards consensus about what to include in this report. Significant effort went into selecting the elements that you'll see presented here. This section represents a snapshot of outcomes, showing Santa Barbara County percentages compared to California state data to provide context for how our county is performing. The committees identified these as important indicators of child and family well-being. More detailed information is available in the full scorecard. We found that 84% of people who gave birth in the county received prenatal care in the first trimester, compared to 86% statewide, a relatively close comparison. However, we discovered an interesting pattern. When we looked at reading at home 3 or more days per week, this indicator shows that children are being nurtured and receiving mental stimulation. Parents are providing what children need to support growth and learning through talking and reading, which supports adult-child relationships and school readiness. Yet when children reach kindergarten, readiness assessments show that only 33% are ready, suggesting something isn't translating effectively. These discrepancies highlight areas where we need to be curious about the underlying factors. For example, the read at home 3 or more days per week measure comes from survey data and we should acknowledge its limitations. Survey responses typically skew toward middle-class white families more than people working multiple jobs in our community, which affects the statistical reliability of this indicator. The kindergarten readiness data comes from first 5 assessments of approximately 5,635 students, making it quite reliable for our county. But California has not adopted a consistent or comparable measure for the state as a whole. This assessment encompasses multiple components, including social-emotional development, not just literacy skills. The need for mental health support among teens is something we're all aware of currently. Data from youth surveys shows we're significantly higher than the state average. This could indicate we're getting better at tracking these issues, or it may reflect that our young people are genuinely struggling more. Nearly half of teens thought they needed help for emotional or mental health problems in the last year, and nearly 1 in 10 ninth graders in public schools had used alcohol or drugs in the last month. Parents may not know what to do to help. If Santa Barbara County parents of children aged 6 to 17 are similar as those in the rest of the state, only about 60% feel confident that they can share ideas or talk about things that really matter with their children. The new emphasis on mental health in schools and media, along with efforts to destigmatize mental health support, is crucial. We hope that a new emphasis on mental health helps both children and parents learn skills and strengthen their relationships. We also identified other important indicators. Traditionally, we have prioritized statistics from protective services as a measure of well-being among our youth. Children found to be maltreated, kids in foster care, and youth supervised by juvenile probation. Now, we're taking a broader approach that gives more weight to school statistics, early learning indicators, and health statistics. This gives us a more comprehensive, whole-person view of outcomes rather than focusing solely on crisis interventions. It's very encouraging that almost all teens agree that people in their neighborhood are willing to help them. In school, student achievement is lower than the state overall. Just under 40% of public school students met or exceeded grade level standards for English, and less than a third of students met or exceeded grade level standards for math. Although schools of any student makeup can be effective, research shows that schools with more low-income students tend to have lower levels of achievement. Students from low-income families often face more challenges in school. In 2022-23, 61% of students in Santa Barbara County public schools were low-income and 25% were English learners. That said, more than 90% of our students graduate from high school in 4 years, and that's higher than the state. Child Welfare Services data suggests that the rate of child maltreatment has decreased in the last decade. In 2023, the county's rate was lower than the state's. An average of 388 children were found to be living in unsafe conditions and were placed in foster care with Child Welfare Services in 2024. Best practice for children is kinship care by a relative or non-related extended family member. From 2015 to 2020, the county increased relative kinship care by 50% and reduced placements in group homes or shelters by about 1/5. After a dip during the pandemic, the number of youth supervised by the probation department has risen, along with the number of crimes committed by youth. At the end of June 2024, 287 youth were being supervised. To prevent or reduce the potentially negative impacts of a young person's involvement in the justice system, more youth referred to probation did not become formal wards of the court because lower-level interventions were matched to their needs. The committee also identified a number of important areas where there just isn't enough data. In some cases, we have data at the state or national level, but not at the county level. In some cases, we have data about people who have public insurance, Medi-Cal, but we don't know about those that have private insurance or no insurance. We know that sleep is crucial for children, but we don't have a way to measure whether kids are getting enough sleep. We know families need help, but we don't have a measure of whether families are accessing support services consistently. We have some sense of this from our family resource centers and organizations connected to family resources, but we don't have a systematic way to track and measure this data. We also need better data on whether children are receiving developmental milestone support. Are they getting screened for development at early stages? Are developmental challenges only being discovered later when interventions become more difficult? We need to know if children are getting appropriate screening and follow-up services. Sleep is particularly important because healthcare providers are starting to ask about it more systematically. When doctors ask about bedtime routines, they're also educating families about appropriate sleep schedules. For example, when families say their children go to bed at 10 p.m. because all their friends do, providers can educate them about earlier bedtimes, like 8:30 p.m. This highlights the need for better public education about sleep importance. While organizations like First Five focus on early childhood development, education is not always prioritized. Many children follow late bedtime patterns without families understanding the importance of adequate sleep for healthy development. Sleep issues affect both children and adults, and modeling good sleep habits is important for families. Sleep impacts weight management and overall health, making it a critical area for measurement and intervention, especially for families who may not have regular healthcare access. The lack of adequate data calls us to figure out how to shift practices to begin collecting more information in key areas. Now we'll look at the conditions for raising children in Santa Barbara County. This part of the report looks at things that affect how families raise their children in Santa Barbara County. The key conditions fit together like puzzle pieces. They're interconnected rather than separate from one another. There's significant interdependency among these conditions, and you need them all to get a complete picture. We examined 5 key areas, also known as social drivers of health and well-being: economic stability, healthcare access and quality, education access and quality, social and community context, and the built environment. The COVID-19 pandemic, which started in spring 2020, had a big impact on these 5 drivers. It made existing problems worse and created new ones. Economic stability was significantly impacted. Many families faced job losses, reduced work hours, and increased childcare responsibilities. Education access and quality were disrupted as schools shifted to remote learning, highlighting disparities between internet access and technology resources. Healthcare access was affected by both increased demand and reduced in-person services, while mental health needs escalated. While some impacts may be temporary, others could have long-lasting effects on child development and family well-being. This is why we felt it was important to have a post-pandemic baseline represented through the scorecard. As an example of economic stability measures, we examined children in poverty, infants who cannot access licensed healthcare spaces, and housing affordability. A particularly striking indicator is that it would take 144 work hours per week to afford rent for an average 2-bedroom home on minimum wage, significantly more than a full-time work week. We also looked at how many residents in Santa Barbara County are cost burdened by housing expenses. Only 13% of households can afford to purchase a home, making Santa Barbara County one of the least affordable counties in California for home ownership. These are just a few examples of economic stability measures. There's much more detailed information available in the full scorecard. Looking at healthcare access and quality, we found that 68% of children under 18 in Santa Barbara County are enrolled in Medi-Cal. We have data about children receiving medical services, but there are gaps in our countywide data collection that limit our comprehensive understanding. A concerning finding is that although 2/3 of children are enrolled in Medi-Cal, only 64% received well-child visit exams in the first 15 months of life, and less than half of the children on Medi-Cal insurance are screened for risk of developing behavioral and social delays before their 3rd birthday. This suggests we can do better with this population. The screening rate for Medi-Cal population also raises questions about what screening looks like for children with private insurance, and there we have no information. Regarding education access and quality, the public education system serves 92% of elementary, middle, and high school students and offers a variety of courses to help prepare them for college and career. All children are offered free meals in kindergarten, and less than 10% of students in 7th, 9th, and 11th grade feel unsafe at school. These indicators show various aspects of quality education. Social and community context includes factors like community organizations and opportunities for parent leadership, community input, and engagement. We also examined resident demographics and community perceptions. There's significant discussion about immigration, and we know that in our county, about 28% of children live with at least one parent who is an undocumented immigrant. When we look more closely at the data, we see that 22% of residents are foreign-born, and that's the same percentage that was recorded in 1920. This suggests that immigration patterns aren't necessarily explaining current community challenges, and it's important to have accurate data to address misconceptions. 58% of those eligible for CalFresh food assistance are not receiving it. If people are eligible but not accessing services, we need to be curious about the underlying barriers preventing access to these benefits. Wages are also a topic of interest. In 2022, 37% of workers were paid an hourly wage under $19.69. Our economy relies on these low-wage workers, and public benefits supplement the wages of many as they care for their families. The neighborhood and built environment includes factors like access to green spaces and risk of natural disasters. We found that there are 2.7 parks within a half-mile of neighborhood population centers compared to 2.4 for the average U.S. city, indicating a relatively good access to parks and open spaces. However, we also have very high risk when it comes to natural disasters. Given that we're in a high-risk area, we need to focus on meeting standards for emergency preparedness for all communities, with emergency information available in the primary languages spoken by our community members. Another section of the scorecard digs into the system of care for families. It includes celebrations and critical needs that the committees that developed the scorecard wanted to highlight. We visualize the system of care in two ways: as a continuum of programs and services that promote safety and well-being, designed to support families according to their needs, and as a system of interconnected parts, each essential to the whole, working together to ensure that the continuum operates effectively. Every family faces challenges while raising children. In fact, managing adversity is an essential part of growing up and preparing for adult life. When families are healthy and community conditions are supportive, parents and their children can navigate common struggles successfully. The system of care is a loosely connected network of organizations and institutions, including government agencies, nonprofits, and community organizations. Viewed as a continuum, we have primary prevention at one end, which encompasses the assets in our community that support all children. These are the interventions that help children before they're exposed to potentially harmful experiences. This includes healthy and supportive community conditions that ensure access to resources that all kids need. Primary prevention includes education programs that promote stress management, social skills, and drug resistance. It also includes concrete support for working families who face persistent hardship due to limited earning potential. For these families, public programs such as Medi-Cal and CalFresh can become an integral part of how they care for themselves and their children. Secondary prevention involves services that are more targeted, specifically designed for children and families who have risk factors or face challenges requiring extra support to address emerging issues. No matter what a family's economic situation is, at times stressors can accumulate and become harmful. In these situations, individual family members or the family unit as a whole may need a higher level of support. Secondary prevention includes programs and services designed to help families reduce risks and strengthen protective factors. In some cases, children may require protection that their families are unable to provide, necessitating intervention from child welfare services and the legal system. Similarly, if youth engage in criminal behavior, juvenile justice may need to play a role in their lives. Care at this level can be voluntary or court-ordered, and families receiving services at this level are sometimes referred to as system-involved. Tertiary prevention services aim to ensure that children and families who need intensive support receive optimal care and coordinated services that can help them positively change the trajectory of their lives. The focus is on mitigating harm and reducing the long-term impacts of adverse childhood experiences. As we examine the system of care, we look at the sectors involved, referrals made between organizations, how navigators help families access services, funding that supports all services, and the networks that coordinate services and activities to improve the system itself. This entire continuum needs to be well coordinated to be effective. The system components are also interconnected. We start with the various sectors that make up the system. No single organization can provide everything families need, so it's helpful to understand who provides what services. We can always improve our understanding of community resources and what's available. Building relationships with organizations that offer different services than we do enables us to make warm handoffs and better serve families through coordinated care. Consistent with a whole person approach, collaboration and integration of care across child and family serving sectors is increasing. When we discuss referrals, key factors to consider include wait times and feedback on outcomes. Is the person who made the referral informed about whether the client actually received help? Are families able to track services they received on their own? Electronic records are becoming standard in the healthcare industry and are now expanding into social service sectors. This enables better coordination between agencies and supports care management teams that take a whole person approach, ensuring families have access to everything they need through the easiest possible pathway. We see this happening through navigation services. It's challenging when different organizations across the community have separate intake processes and eligibility requirements. When you add language and transportation barriers, it becomes very difficult for families to get the help they need. If we want to improve our outcomes, we need people in navigator roles who can help families connect to all the services that are important for their well-being. This coordinated approach is essential for reducing barriers and improving access to care. Another part of the system is funding. In Santa Barbara County, we see government contracts with individual organizations and collaboratives. There may be grants received in partnership with other counties. Foundations and private donors also play an important role. Keeping the system healthy requires us to consistently assess the needs and identify appropriate funding. In the current climate, this part of the system is being stressed by budget cuts, policy changes, and volatile financial markets. This is an opportunity for us to create even stronger relationships and more transparency to ensure that we are maximizing resources to ensure the best outcomes. The last piece in the system puzzle recognizes networks for the role they play in building trust and connection between organizations and sectors. Sometimes networks include different organizations doing similar work, and sometimes they bring together organizations that do very different work. Frameworks and best practices for helping children and families are shared through networks, making them an important component in the system of care. Networks enable us to make connections with each other and strengthen the system as a whole through collaborative relationships and shared knowledge. We asked stakeholders to identify areas for celebration, and cross-sector collaboratives emerged as a key theme. We've been making progress in this area across every part of our system, from behavioral health collaboratives in schools to prevention collaboratives and other specialized working groups. There's significant activity happening in cross-sector collaboration throughout our community. Another celebration is that we have elevated diversity, equity, and inclusion at the organizational, personal, and community levels. There's a strong commitment to creating a community of belonging. While we may need to adjust our language or shift certain approaches, there's a genuine dedication to fostering a sense of belonging for everyone in our community. These efforts deserve recognition as important celebrations of our progress. We also asked stakeholders to identify critical needs, and three key areas emerged: workforce shortages, the need for a data infrastructure, and the need to emphasize positive childhood experiences. In the area of workforce, we see a need for coordinated county-level responses to workforce shortages. The high costs of housing and childcare are not only impacting families, but also the staff serving them. While raising wages is important, it alone can lead to inter-county turnover and instability. Key statistics highlight the severity of these issues. We also see a need for continuing advancements to create a data infrastructure that facilitates coordination, continuous improvement, and shared accountability for the system of care. And while we've spent considerable time discussing adverse childhood experiences, which is important for understanding the factors that influence well-being, we have more potential to influence positive change if we focus on the future. Each organization and individual should understand how they can create positive childhood experiences. With this knowledge, we can mitigate the impact of toxic stress and make our community healthier overall. The 2024 Santa Barbara County Children's Scorecard presents a nuanced picture of the intertwined conditions for raising children, the system of care for families, and outcomes for children and families in our community. It offers points of connection for organizations and collaborations. and the post-pandemic baseline data that can be monitored over time as markers of evolution and progress. Because Kids Network is an advisory body to the Board of Supervisors, we originally framed recommendations as a call to action for the board. However, we know that raising children is a collective endeavor, and therefore these recommendations are also relevant for city leaders, funders, organizational leaders, and boards of directors to understand the most important areas for action. The recommendations focus on maximizing opportunities to improve economic stability and working across the county to ensure each county department follows a no wrong door approach. Whether you come to public health, community services, or social services, families should be able to access the help they need. Acknowledging economic realities, efforts should focus on offering families a hand up while they work to achieve their own version of the good life and the best possible outcomes for their children. We need to increase investment in North County where the need is greater. And we need to address workforce issues that emerged during the pandemic and continue to impact programs and services. We also need to establish a data infrastructure that includes county departments. There are dashboard efforts happening in different parts of the work, and we should all be heading for a unified plan. Additional recommendations and opportunities include measurement of indicators in this scorecard for which there are incomplete or inadequate data. Also, learning from parents and other community members who have lived experiences that can help us improve the system so that it becomes easier to navigate. In response to current challenges, we developed additional recommendations to help us stand together in community. We encourage you to understand that many families are losing access to services and supports, and that stress within families may make it hard for children to learn and self-regulate. Take initiative to foster positive experiences and supportive relationships. These are critical. Do your best to support one another and offer smiles when you can. Learn about the services in your community and stay abreast of changes. And finally, honor the resilience and fortitude that has grown from the past. Investments made today can enhance conditions for raising children, improve care coordination, and create opportunities that lift up families, shaping the future of Santa Barbara County for generations to come. By working together, we can build a brighter, more equitable future for all children and families in Santa Barbara County. Thank you so much for joining us for this important webinar about the 2024 Children's Scorecard. Please feel free to reach out if you would like additional information, and we encourage you to take some time to explore your interests and to make your efforts more impactful in Santa Barbara County. Thank you.